Just going for the last thing of the session. So Dr. Nivedita has prepared some quiz, and whoever gives the answer will get a prize. So these are good. I hope you enjoy. All the best. So I request the faculties not to give the inputs in the beginning. We can do it after the delegates. Delegates get the preference, please. Thank you.
And sir, we will have chocolates for faculty also. Okay. So a very good evening, everyone. On behalf of Department of Anesthesia, Yathathcon Super Speciality Hospital, Greater Noida, I welcome you all. So under dynamic mentorship of Dr. Anshuman Mishra, we are also running observership program under 4 domains of anesthesia: regional anesthesia and perioperative ultrasound guided nerve blocks, transplant anesthesia, POCUS, and anesthesia for robotic surgery. And we had delegates not only from India but from countries like Dubai and Kenya, and we had very positive feedback. So with this we come to last session of the day. So this is our department photograph with our observers. So with this we come to, can I have the hand mic? So with this we come to last session of the day, and it is going to be an interactive session. So please, I expect active participation. So first few questions are in the form of riddle. So I may talk about a nerve, a block, or an ultrasound sign. So let's identify. So my first riddle. I am your go-to solution for every problem. I am behind you under all circumstances. I am so sincere, yet so controversial. My presence may be proxy, but you cannot ignore me. What am I? No. We have covered everything today in live demonstration and panel discussion, let me tell you. No. See, I am behind you under all circumstances. So, no, sir, no. Sir, it's a block. Yes, ESP. Excellent, sir, excellent.
Who said? Sir.
So let's move on to next riddle. One quiver, many arrows. Master me and I will take away all your sorrows. Thumbs up for your good scan. I'm cute bunny. Catch me if you can. Okay, so I will give QL. Only thing is, it is only one arrow in the quiver. I am looking for a better answer. But I will give chocolate to you if I don't find a better answer. Sir, you are the last person. Some better answer. It's a sign on ultrasound. Shamrock sign. Excellent. Excellent. So moving on to third riddle. I'm in middle, but still superior. You hit me, still I let you breathe. In combination, I'm complete. Feeling tired? Come to me. Identify me. No, not interscalene, I'm sorry. Something close nearby.
Feeling tired, come to me. Where do you go to when you feel tired?
No, sir, not phrenic nerve. Superior trunk block, yes. And with this, I would like to add the third line of the riddle. In combination, I am complete refers to combination of superior trunk block with supraclavicular nerve block, first described and beautifully demonstrated today by Dr. Shiva sir. Okay, so next riddle. I am formed from 2 parts of the same nerve. I live inside hammock with a small companion. Sir, let me complete. I am very generous and always ready for sacrifice. Identify me. No, sir, not sciatic. No. See, I am very generous and always ready for sacrifice.
Femoral नहीं है ना?
No. So I asked this riddle to surgeons, and all surgeons were able to answer this question. All surgeons, even neurosurgeon in our department. Okay, so I'll give you one more clue. See, I will tell you this is calcaneum here. No sir, not posterior tibial. I can give you another hint. Huh? Yes sir, it's sural nerve. So this is sural nerve. So it's sural nerve is found with small saphenous vein and it's inside the hammock. Okay, so my last riddle, but not the last question. I wiggle my way out between two muscles. Come near me and I will pull you closer. Miss me and it will not be pleasant. I'm so important and yet ignored. Identify me. Huh? No. Come near me and I will pull you closer. No, not. No, sir, please. I'm not listening. No. No, sir. The people sitting on first row. Who? Excellent. Okay, great. So this is musculocutaneous nerve, right? Okay. So next question is in a form of case scenario. Interscalene brachial plexus block was given for proximal humerus surgery on the left side using 12 ml of 0.75% ropivacaine. 60 minutes after the block, patient started complaining of respiratory distress. Who said? So that is why my question is not that, because I know everybody will answer that. So my question is, what will be the findings of POCUS and grading on the basis of that, and what will be findings on chest X-ray?
Pneumothorax?
Splenic nerve palsy.
Pneumothorax.
Huh? No, not pneumothorax. See, it's splenic nerve palsy. I can tell you the case scenario. Exactly. It's elevation of hemidiaphragm on the same side or eventration of that diaphragm. What will be findings of POCUS and grading on basis of that? What shall we look on POCUS? Diaphragmatic, yes, please.
Diaphragmatic movement.
Also known as diaphragmatic excursions. Excellent. And grading on the basis of that? Okay, so I will give that answer. So we measure diaphragmatic excursion pre and post block. Less than 25 reduction in diaphragmatic excursion is considered to be normal. Between 25 and 75% it is mild phrenic nerve palsy, and more than 75% it is complete phrenic nerve palsy. Okay, so next case scenario is for he's a 38-year-old male smoker, came with history of fatigue and breathlessness on exertion since last 1 week, with breathlessness on rest since last few hours. There is no significant past history and there is no history of cough, cold and fever. So a chest X-ray was done, which was completely normal, and lung ultrasound was done, which revealed A profile. And now a quick echo was done. So can somebody describe this view and the findings for me? Anyone? Yes, sir, please.
This is the parasternal short axis view.
Excellent.
The RV appears dilated in this and the septum is D-shaped.
Exactly.
So this may be a pulmonary embolism or RV strain pattern. Basically.
Yes, fantastic. And so if you happen, sir, it's continuing. So if you happen to keep a probe and view IVC at the time of acute embolic event, what will you see?
You can see the thrombus
Hyperechoic fragments are moving from IVC to right atrium. Thrombus. Next, a quick scan of lower limb was done to rule out DVT. And what we saw? Thrombus. Excellent.
So I think the POCUS teachers were better than the RA teachers.
Okay. So next question. 45-year-old male developed signs of LAST after giving intercostal nerve block under general anesthesia. He developed arrhythmias followed by cardiovascular collapse. Cardiopulmonary resuscitation was started along with intralipid infusion. So what not to give during CPR? Vasopressin, sir. And what else during arrhythmias what we should avoid? So vasopressin or epinephrine we got lignocaine. Excellent. So what is the dose of adrenaline to be given during last? So, sir, less than 1 mic per kg. So just imagine a 50 kg, a person who is weighing 50 kg will receive only 50 mics of epinephrine as compared to 1 milligram in normal resuscitation. So what is the maximum dose of intralipid? Sir, people are sitting. Please. Sir, Dr. This is not done, sir. This is not done. Okay. So the point of this question is we are giving blocks right from our first PG years with so much of local infiltration by surgeons right and left. So the thing is we should know, this is the algorithm given by ASRA. So we should know our last resuscitation like we know our ACLS resuscitation. So please be aware, last resuscitation is different from standard ACLS. So next question. This is heart, surrounded by fluid on all sides. Can somebody identify fluid compartments for me? What all fluids you can see? Anyone try? Somebody from back. See, all black is fluid. What all fluids can surround heart? Pericardial effusion, pleural effusion, and ascites. So this is which view? Subcostal view. Sir, please chocolate for us. Okay. So this is diaphragm. Above diaphragm we have ascites. This is right pleural effusion and traces of pericardial effusion both anterior and posterior to the heart. Great. Okay, so next riddle, next question. ASA2 patient post-op total laparoscopic hysterectomy was shifted in PACU after uneventful anesthesia and surgical course. 45 minutes post-surgery, PACU sister raises alarm. Last 3 BP readings were showing decreasing trend. So on examination, patient was conscious, oriented, and pain-free. Heart rate was around 110 beats per minute, and BP showed decreasing trend even after fluid challenge. ECG showed sinus tachycardia. So a quick focus was done. And please somebody, it's comparatively an easy collection in Morrison's pouch. So fast was negative, patient was taken back in OT, bleeders were recognized, hemostasis achieved, extubated on table and shifted to PACU. So next question. 70-year-old female in urosepsis with shock was catheterized to monitor urine output. After 30 minutes, not a drop in urobag. Can somebody identify? False catheterization. Its Foley is gone wrong. Great. Okay. Push, pull, pinch, pinch. 4 P's for assessment of upper extremity nerve blocks. Sir, not, please, this is no, I am not expecting any answer from first row. What is the 4 P's acronym for assessment of lower extremity nerve block? Push, pull, pinch, pinch. What are the 4 nerves that we want to assess in lower extremity nerve block? Okay, so I shall pass. Okay, so I shall give the answer. So it is push to test for sciatic nerve block, pull for obturator nerve block, pinch for LFCN, and punt for femoral nerve block. Okay, so next question. Please identify this gentleman. He is founder, father of ASRA. He introduced facial sheath concept, also gave us subclavian perivascular approach, and also gave us 3-in-1 block. No, sir. And he has a very inspirational story. Alan P. Vinny. So just let me tell you, sir was paralyzed after an attack of polio, and everything that he did was from a wheelchair. Very inspirational story to read. So with this, I come to last question of the quiz. 67-year-old male came to casualty with complaint of severe back pain. While examining, patient collapsed. Can somebody identify the video? Try. Sir, close. It's not dissection, sir. It's thrombus, aortic thrombus, large aortic thrombus. Okay, so something else is there in the image. Can we see some rhythmic movement? Continuous rhythmic movement. What is this rhythmic movement? What is this? Patient has collapsed. So what is this rhythmic movement? It's an ongoing cardiopulmonary resuscitation. Okay, so now American Heart Association advocates the use of ultrasound during ongoing cardiopulmonary resuscitation to rule out causes of cardiac arrest. So with the help of ultrasound now, we can rule out 2 of H and 4 of T's. Right, so how? So they have given this beautiful flow diagram. So in this pic, they have described the places where to keep the probe. Mind you, you acquire image while chest compressions are going on. At any point of time, we don't have to interfere the chest compression. And during pulse check, we interpret the image and we rule out or diagnose the causes of cardiac arrest. So with this, I come to the end of the quiz. Thank you for active participation and patient listening.
Let me ask the Riddler itself. What was the quality? I mean, did you find the questions good enough? Because you didn't get any answer.
You didn't allow me to answer. Hello.
How did you get chocolate?
Riddler always gets chocolate.
The first line he could answer it.
That's why he was not given any chance to answer.
No, it was very nice. Please keep it up. And thank you for all your contributions today.
You didn't dress yourself in a bunny costume.
I didn't, sir. Thank you so much, sir. Thank you.
So this brings us to the last part, and that will be the certificate distribution of whoever the delegates are present here. And after this is done, we'll move straight to the Radisson for the dinner. So those who do not have the conveyance, we will pick you up and drop you there in the hotel. So that's, please meet me, we'll plan that thing. Can I ask Dr. Devendra, please?
Yes.
I request
Dr. Gopal to kindly help us in felicitating our delegates. Dr. Gopal, sir, please. Sir, we just have to hand out the certificates to the delegates. If you would kindly help us doing that. Dr. Apurva Sadhu to begin with. Dr. Apurva. Okay. Dr. Pankaj Kumar Gupta. Dr. Pankaj. Dr. Mahesh Sudhakar Kurve. Dr. Satyendra. Dr. Satyendra Kumar. Dr. Nitin Johar.
Sir is Dr. Satyendra sir, at this age, this stage, he is very fit. He runs marathon and he sat throughout and he has the learning to come and he had this interest to come and learn. Thank you, sir. Thank you.
Dr. Nitin Johar. And Dr. Monas. Dr. Mona. Dr. Mona. Thank you, Dr. Gopal. May I request Dr. Deep Arora to kindly come to the dais now. Dr. Umeza Khan. Dr. Umaiza. Umaiza. Dr. Neha Chaudhary. Dr. Cheshta Goel. Dr. Cheshta, and after this, Dr. Shreyashri. May I now request Dr. Amjad to kindly come to the dais? Thank you, Arora sir. Mekhala Ranjit Kumar. Dr. Nupur. Dr. Nupur Agrawal. Dr. Rajesh. Dr. Rajesh Malhotra. And Dr. Vijeta. Dr. Pradeep. Dr. Pradeep. Dr. Vijay Patil. Thank you, sir.
Thank you, everyone. So for tomorrow, the breakfast session would be in the B1, in the basement 1, in the OPD room. The breakfast would be on from 7:30 a.m. and the sessions will start at 8:30 a.m. sharp, because most of the faculty's flights have been rescheduled, and we want to push maximum possible people so that they can finish and then they can go on leave for the thing. So be on time, will start sharp at 8:30 a.m. tomorrow. Those who do not have conveyance, please come and stay with me. We will take you to Radisson. Fine? Thank you. Any query? Thank you all. Thank you all for your support. Thank you.